Okay, everybody. So we were talking about immunity-related disorders. So in last lecture, I talked about the lymphatic system, right? That is responsible for immunity. So we'll continue that immunity and related disorders. So you remember that acquired immunity which is also called adaptive or specific immunity. Okay, so this acquired immunity has 2 weeks: cellular or cell-mediated and humoral or antibody-mediated immunity. Okay, cellular is also called T-cell mediated immunity. Humoral is also called B-cell mediated immunity. Okay, so cellular is given by T lymphocytes. Humoral is given by B lymphocyte. Okay, so those are acquired immunity that develops in the body in response to antigen. We don't get that by birth. When antigen enters into your body, in response to that antigen, your body produces acquired immunity. Make sense? Innate is already there, like skin or mucous membrane, right? We have already that in the body. Now, in last class, you remember I said T cells could be different types. T lymphocytes could be different types. And I said cytotoxic T cells, helper T cells, suppressor T cells. Another one I mentioned, anybody? Memory T cells. Okay, so those 3 as well as another type of T cells, those are called memory T cells. So cytotoxic, let me write down again, suppressor, then helper and memory and helper. Now these are different types of T cells. Cytotoxic, its name is telling you its function. Cyto means cell, you know that. Toxic is harmful, right? So this type of T cells destroy the bacteria or virus or microorganisms. Okay, so destroy the enemies. So how cytotoxic T cells work, I'll just briefly give you a little idea. This is a bacteria. Okay, so this is cytotoxic T cell. Okay, cytotoxic T cell. What it does, it releases a chemical that is called perforin. That chemical is released by cytotoxic T cell. Okay, cytotoxic T cell, and that chemical gets attached to the cell membrane of the bacteria and make holes or pores in the wall of the bacteria. So this is the bacteria. Okay, so in the bacterial wall, the perforin gets attached, okay, and makes what? Holes in the wall. Is it clear? And then the cytotoxic T cell next releases another type of chemicals that goes inside the bacteria and degrades the enzymes of bacteria. So inside the bacteria, those enzymes are there. This chemical goes in and destroys or degrades enzymes inside the bacteria. So bacterial metabolism stops. Make sense? Metabolic activities get stopped. So the bacteria will die. Okay, so it will die. So degrading chemicals are poured inside the bacteria. So you see how beautifully, right? So first the cytotoxic T cell will release perforins and that will make holes, then will release that degrading chemicals that will get in and will degrade the enzymes inside the cells or bacteria, and that will stop the metabolic activities of the bacteria and it will die. Okay, so that is how cytotoxic T cells destroy the bacteria. Suppressor T cells. This one is very important. That your immune system sometimes tend to work more than what we need. So sometimes it becomes what? Try to become overactive. Make sense? Hypersensitive, hyperactive. So the suppressor T cells try to keep the immune system suppressed or under control. That's why they are called suppressor T cells. Okay? So if other types of T cells like cytotoxic T cells or memory cells or helper cells or B cells, they tend to work more than what we need, right? That will cause problem, right? So the suppressor T cells keep them under control. Now why this is very important? You see, if the suppressor T cells don't work, then what will happen? Immune response will be more or less in your body if suppressor T cells don't work. Immune response will be more. Makes sense? Because the suppressor T cells try to suppress, keep the immune system under what? Control. Makes sense? So now if suppressor T cells are not there, then immune response will be more than that we need, right? So that can lead to autoimmune disease or hypersensitive reactions of the body. Make sense? So that's why suppressor T cells play regulatory role, and they are also called regulatory T cells. Regulatory T cells. Memory T cells are produced in your immune system when you get exposed to any antigen. For example, any bacteria or virus enters into your body, right? Your body produces, when your body encounters that antigen, your body produces memory T cells. Make sense? And the memory T cells stay in your immune system. When second time, same kind of, bacteria or virus tries to enter, then you have the memory information, right, about that enemy. So your body will do what? Quickly respond, right? So that's why memory T cells are very important. Helper T cells, another type of T cells, they do what? So these are the cells of your immune system. For example, this is T cell, B cell, macrophage. Okay, you know these are very important in your immune system. So this is helper T cell. Okay, this is helper T cell. HT. Okay. Now, just know that helper T cells, when antigen antibody, this is the antibody, antigen antibody complex, this is antigen antibody complex. Let me write it down. Antigen antibody complex gets attached to the helper T cell. Helper T cells release a chemical that is called cytokine. Cytokines. Okay? There are different types. So helper T cells release cytokines. Okay? And cytokines are very important in immune system or immunity. Cytokines stimulate the T cells, B cells, and macrophages. So they will become more active. Make sense? So we'll stimulate those cells. So they will perform their actions more. So basically, stimulate or activate cytokines. So that's how the helper T cells work. So these are 4 different types of T cells. Cytotoxic T cells not only destroy the bacteria, but also destroys the cancer cells or tumor cells. Okay, cancer or tumor cells. Cytotoxic. Okay, so those are different types of T cells. Now B lymphocytes are converted to plasma cells. Plasma cells. And in last class probably I mentioned, once B lymphocytes are converted to plasma cells produce plenty of antibodies. So some books say B lymphocytes are one type of, plasma cells are one type of B lymphocytes. Actually B lymphocytes, some B lymphocytes are converted to plasma cells. Okay. Also we have memory B cells. Memory B cells that keep record of previous exposure. Okay. So those are the T cells and B cells. Okay, need to know that to understand the immunity. Okay, let's move forward. Hypersensitivity. There are 4 different types of hypersensitivity. Type 1, type 2, type 3, and type 4. Type 1, 2, and 3 occur very fast, quick, within few minutes to half an hour. Okay, so those 3 types are quick response. And type 4 is slow. It may take days to show the response. So those are 4 different types of hypersensitivity of your immune system. So now hypersensitivity 1 occurs due to overproduction of immunoglobulin E. You must remember in last class I mentioned 5 types of immunoglobulins are important ones, right? There are more than 5, but 5 are very important, and this is one of them. So overproduction of immunoglobulin E does what? stimulate the basophils, mast cells, those cells, and then they release, in last class I mentioned, histamine, bradykinin, and serotonin. Histamine is the main one. So let's see. You see here, overproduction of immunoglobulin E. Antigens could be pollen, dust, animal hair, or certain food, and that will stimulate the immune system to produce more immunoglobulin E that will bind with the basophils and mast cells and will release histamine, serotonin, bradykinin from those cells. And that will cause vasodilation. So these chemicals will do what? Vasodilation. So more blood will flow. And now also when the blood vessels dilate, the pores get bigger, right? The holes in the blood vessels will get bigger. So fluid will come out, edema will occur, that I mentioned in last class. So that's the response. Swelling, edema, when fluid gets out from the blood, enters into the tissue, right? Surrounding tissue. So you will see fluid accumulation there and swelling, right? So redness, those things you see there. So that is one thing you see the response in your body. Another is constriction of the respiratory tract. That is also hypersensitive response, constriction of the respiratory tract, and that could be severe in anaphylaxis. I mentioned anaphylaxis in last class. This is the most serious form of hypersensitivity, anaphylaxis, okay? Anaphylactic shock, probably you have heard. So what happens, you see, when the immunoglobulin E are produced, they go everywhere in your body and stimulate all the mast cells, okay, and basophils. So they will release a lot of histamine, bradykinin, serotonin, and that will do what? To use vasodilation. Okay, so blood vessels throughout the body will dilate. Now you see two things will happen here when the blood vessels dilate. Now you tell me, if blood vessels dilate in your body, blood pressure will go down, right? Blood pressure, blood vessel dilation, vasodilation decreases the blood pressure. So when that happens throughout the body, blood pressure significantly drops, right? So that is one response of, anaphylaxis. Another is a lot of fluid gets out from the blood. That causes edema, right? Now if fluid gets out from the blood, the volume of blood will go up or down. If fluid gets out from the blood volume inside the blood vessel will go down. Makes sense, right? Because fluid is getting out. So blood volume, when blood volume gets down, low, that will also cause hypotension. Will decrease the blood pressure. Make sense? So you see, vasodilation decreases the blood pressure. Number two, fluid gets out from the blood, right? Blood volume goes down. That will also add. So the blood pressure will significantly drop, and that patient can go to shock or coma. And if the strong constriction occurs in the respiratory tract, that is another dangerous thing, and the patient may die if you don't treat the patient immediately. Okay, airway obstruction. It's the same thing here. Okay. Type 2 hypersensitivity occurs due to immunoglobulin M and G. And immunoglobulin M and G directly get attached to the cells and cause the destruction of the healthy cells of your body. Okay, and that occurs in case of two conditions I'll mention where hypersensitivity type 2 occurs. In both conditions, red blood cells are destroyed. Okay, destroyed. Number one is mismatched transfusion of blood. So mismatched blood transfusion is number one, where what happens, if a person's blood type is A, and if you give accidentally, you give type B blood to that person, what happens? The red blood cells are destroyed. Okay, so I will explain why that happens. So this is one, type 2. Another is a clinical condition that happens in infants, that is called erythroblastosis fetalis. Have you heard this? Anybody? Erythroblastosis fetalis? You did. Okay. So
where the mother's blood attacks the babies?
Yes. So if mother's blood is Rh negative and fetus is Rh positive, right? In that case, the fetus will suffer from erythroblastosis fetalis, may suffer. If that is first pregnancy, the fetus will not get affected. Make sense? But in second, third, in subsequent pregnancies, the fetus will get more and more affected by this erythroblastosis fetalis. So this is interesting clinical condition. Let's first talk about this. If the mother is negative, what does mean negative blood and positive blood? Okay, so that is determined by the red blood cell. On the red blood cell surface, this is the red blood cell, you have antigens. There are different types of antigens. If this is A antigen, the blood type is A. Very simple. On the red blood cell surface, if you have A antigens, blood type is what? A. Make sense? Simple. If on the surface you have B type antigen, blood type is B. If you have both A and B antigens, AB. If neither A nor B, O. Make sense? So that's how the red blood cells determine the blood type. Now, another antigen that is called D, that determines positive or negative blood. Okay, so if D is present, remember this is related to this. If D antigen is present, that means blood type is positive. If D is absent, blood type is what? Negative. Now you tell me, this is a red blood cell. It has, this is A antigen, This one doesn't have B antigen, and it has D. This is D antigen. Now you tell me, what is the blood type? First, if B is there, blood type is what? B. You remember? That's simple. And if D is present, positive. Make sense? So this blood type is what?
A positive.
Oh, I said A. Sorry,
Yeah.
I said B, but it's A. Great. Okay, so it is what?
B positive.
A.
Or A.
No, because A.
Okay, now you
right?
okay.
So it is A positive. Is it clear? Make sense?
Mm.
Now if I add, just to see if you understood, this one also has B antigen, but no D. So what should be the blood type?
AB negative.
AB negative. Is it clear?
Okay.
Okay, good. So this is AB negative. So you got it. Now another thing is, this is a rule. If any antigen is present on the red blood cell, in the plasma, blood also has plasma, you know that, the fluid part of blood, must have opposite type of antibody, not same type. If same type of antibody is there, then reaction will occur, right? Antigen antibody. So, if this is blood type A, a type of antibody should be in the plasma B.
B.
So A antigen, B antibody. No reaction will occur, right? So that is what in your blood. How the antigen antibody, yes.
What if it's like AB?
AB, no antibody, because both antigens are there,
Okay.
so no antibody in the plasma. Make sense?
So in that case, if it's O blood type, both A and B would be around it?
Yes. So if it is O, that means what? No A, no B. Make sense?
Mhm.
So both AB antibody should be in the plasma. Make sense? Very good. Yes. So now you understood that, so you will understand erythroblastosis fetalis. Okay. So this is mother. Mother's blood is negative. When I said negative, that means D is present or absent?
Absent.
Absent. So in mother's red blood cell, no D antigen. Is it clear? Okay. Now this is fetus inside the mother's body. So fetus is positive. That means which antigen is present? D. Got it? So fetus is positive. That means D antigen is present in fetus red blood cell. And when the fetus blood, since fetus is inside the uterus, mother's uterus, fetus blood by fetal circulation will enter into the mother's blood. Okay? So D antigen will enter into mother's blood. Is it clear? Red blood cells enter into mother's blood. And mother's blood doesn't have D. Okay? But since D antigen enters into mother's blood, in response to D antigen, mother's blood will produce what? D antibody. Makes sense? Because when an antigen enters into your body will produce antibody against it. This is very common response of the body, right? Immune response of the body. So now you see, when first child, mother bears first child, D antigens will enter into mother's body and mother's body will start to produce antibodies. But this process is slow. It will develop slowly. Antibody will develop slowly in mother's body. Is it clear? And when it will get stronger, before it gets strong in mother's body, first delivery will occur. Okay? So first fetus will not be affected. Will be fine. Okay? But even after the birth of the baby, mother's body continues to grow D antibody. Make sense? It develops slowly. Once you got exposed, your body will continue to respond, okay? And will keep increasing the production of antibody. Clear? So when second time, if again the fetus is D positive, positive, that means D is present there, right? Second time, same thing. So again, fetus blood will enter into mother's body, and these antibodies from mother will enter into fetus and will destroy the antigens. So from mother, the D antibody that has been developed, right, over the time will go to fetus body and will destroy the red blood cells. Destroying D antigens means destroying the red blood cells, because It is located on the membrane of the red blood cell. Make sense? So when the antibody will come here, will react and will destroy the red blood cells. Is it clear? So you see here from now, as you know, second child, there is a chance that second child will be affected, but that may not be severe. In third child, that could be much more severe. Yes.
So this condition, this depends on the blood types of the parents, right?
Yes, because fetus blood type will be determined by parents.
So which pairings would potentially this occur?
It depends on the DNA. So if this is father, okay, this is mother. So if father is positive, that means D, we say DD. If this is dominant type, okay, and recessive type, if this is mother, mother is negative, so there is no D, we'll say no D. So in this case, both will be positive because D is there, okay? Yeah. Now if father is this positive and mother is negative, now you see
It's a possibility.
this is, yeah, this is positive, right? But this is negative. Make sense? So that's how the, you know,
So as long as
What type of
one parent is positive, then there's a chance.
yes, yes. Okay, so if second child is negative, no problem. Because on the red blood cell no D antigen, so even antibody enters, will not find any antigen. Make sense? So will be safe. Now why this is called erythroblastosis fetalis? You see, when in fetus body the red blood cells are destroyed in fetus, red blood cells are destroyed in fetus body, bone marrow will do what? Try to produce, replace that red blood cell. Make sense? Will produce more quickly, fast, because red blood cells have been destroyed in fetus body, right? So fetus body will try to produce more red blood cells. And what will happen? Erythroblasts are called immature red blood cells. Erythrocytes are mature. Blasts are what? Immature. So what will happen? Plenty of immature erythroblasts will enter into the blood, fetus blood, to replace. But those are useless red blood cells because they are immature. Make sense? So
They can't carry oxygen?
they can carry oxygen because they have nucleus inside, no hemoglobin. Okay?
Gotcha.
So they will quickly enter into fetus blood, but they are ineffective. Okay? So that is a serious clinical condition, right? Erythroblastosis fetalis. That means in fetus blood you have erythroblasts, premature, immature red blood cells. Okay? So that is the problem. Okay, so those are type 2 hypersensitivity. Type 3 hypersensitivity, what happens, antigen combines with antibody and form antigen-antibody complex, okay? And that complex will be deposited or accumulate inside the tissue and blood vessels. And that will cause inflammation and tissue destruction. So just know that the huge amount of antigen-antibody complex will accumulate in the tissue and blood vessels. Example, glomerular nephritis. If you hear the term nephritis, that means inflammation or infection of kidney, nephrons, nephritis. You know nephrology, right? We use the term nephrology, means kidney disease, the study of kidney disease. So glomerular nephritis is the inflammation of kidney tissue. Also, same thing can happen in the lung tissue, inflammation of lung. As I have mentioned, type 1, 2, and 3 all are immediate hypersensitivities. They develop within about half an hour or sooner. So minutes to half an hour. So quick. Type 4 hypersensitivity is T cell mediated immune response. T cell mediated immune response, and it develops slowly. Okay, delayed response. Example, when you do TB test, tuberculosis test, have you anybody done it? Okay, so you know they inject the antigen, right, and ask you to wait 24 hours, right, and go back to them. Then they will check if your body showed, skin showed response, right? It develops slowly, and that is type 4, example of type 4 hypersensitivity. You remember I talked about cytokines secreted by helper T cells, so that will cause that response. Same thing will happen when you get exposed to IV poison. Slowly. First time your body will produce immune response, then if it happens again, that time you will see more. So what happens, this is, you see, we measure the response by scale, how much, you know, your skin responded to that antigen. Now, that doesn't mean when you do TB test, if you see the response in your body, that doesn't mean you have TB. You'll see some people in the skin, they show response to TB test. Some are negative, some are positive. Positive response, does it mean that person has TB? No, that doesn't mean that person has TB. That means that that person got exposed to TB before. That person got exposed to that disease. It could be directly. He could have suffered before. Okay, is one thing. Another is that person's in family, inside the house, someone had TB. Okay, so your body got that microorganism, but your body you didn't suffer from that, but your body got exposed to. Is it clear? Make sense? So your body got exposed to, but you didn't get, that disease. When you are sitting beside a TB patient, right? That bacteria can enter into your body easily, and your body will do what? Produce antibody. Make sense? And will stay there as memory. Like after 20 years or 30 years, if I inject that antigen to test if your body responds, this is just the response. So your body will respond to that, right? Because your body got that exposed to that bacteria before. So that is type 4 hypersensitivity reaction. And we measure the area. Okay. Now, autoimmunity. Self. Auto means self. So we know that when an antigen enters into your body from outside, like bacteria, virus, right, or any other type of antigen, your body should respond to that, and that is normal, usual. Now, sometimes what happens, your immune system becomes hyperactive and start to consider your own healthy body cells as enemy and start to destroy the healthy cells. So that is not good, right? So that is called autoimmunity. Your own body is fighting against your own healthy cells. Make sense? So now, antigen, when we say antigen, antigens could be from outside, like bacteria, virus, microorganisms, some toxic chemicals enter into the body, pollen, right? Dust could be antigen. So all those, what is antigen? That stimulate the body to produce antibody. That's the definition of antigen, okay? Anything that enters into the body and stimulate the body to produce antibody. It could be dust, it could be pollen, right? It could be a certain type of food that stimulate your immune system if it does, right? That is antigen. So food could be antigen too. So can come from outside. Now antigens could be produced inside the body, for example, cancer cells or tumor cells. We know that these cells are not good. These cells are not good, right? So your immune system will try to destroy, get rid of, right, these cells. So these are also antigens. So you see here, antigens can come from outside, like bacteria, virus, or pollen, or food, or toxic chemicals, or could be produced inside the body. But destroying the cancer cells or tumor cells is good. But if your own healthy cells are considered as antigen by your immune system and destroy them, that is the autoimmunity. And now we know that many diseases are related to autoimmunity. Before we did not know, okay? Diseases were there, but we didn't know the cause. Now we know, like for example, rheumatoid arthritis. We didn't know that it is an autoimmune disease, okay? Common autoimmune diseases, one is, you see, lupus. This is called systemic lupus. You see reactions throughout the body. Okay, you see lupus. This is one rash throughout the body. Scleroderma. This is another condition in which the skin becomes hard, thick, and this is there are two stages. One is early stage or less severe stage, and another is advanced or more severe stage of scleroderma. In early stage, we see thickening and hardening of the skin. In advanced stage, what happens? Internal body organs get hard and shrunk. Okay, so that is a dangerous condition, right? Like if your heart gets harder and shrinks, it will not be able to perform its function normally, right? If your lungs get hard and liver gets hard and shrink, that will not be able to perform normal function. So that is another type of autoimmune disease. So it could be mild or severe. All these diseases are treated by the medicines that will depress or suppress the immune system. So medications that can suppress or depress the immune system are used to treat these patients. here you see thickening of the skin and hardening and thickening. That's the scleroderma of the head. Okay. Now we'll talk about. So you got 3 types of hypersensitivity, right? And certain diseases. Now we'll see a disease that is called AIDS, acquired immune deficiency syndrome, or AIDS. This occurs due to a viral infection. Okay, and that virus is called HIV, human immunodeficiency virus. Human immunodeficiency virus. Makes sense? HIV. And the disease is called acquired